For those of you who don't know me, my name is Nick Paproski. I am on the board of directors for the Connecticut Association of Paramedics and EMTs, or CAPE for short, who is sponsoring today's webinar. Additionally, I am a paramedic and the training officer for Vintech Management Services in Torrington. Today's presentation will have a very specific scope. We will be covering National Registry Paramedic recertification process. I will be making mention to some considerations specific to Connecticut, but that is not our primary focus here today. For those of you not familiar with CAPE, CAPE was initially founded in 2019 to provide legislative advocacy representing Connecticut's EMTs and paramedics. In addition to this, CAPE also provides its members with additional benefits, such as exclusive online CMEs and member support resources. You can find us on the web at cape911.org. You want to head over there and bookmark our page. You can find us on Facebook by searching for @cape911, as well as for searching for Connecticut Association of Paramedics and EMTs on YouTube. And do all the like and subscribe features there. It really helps us out. CAPE is a great organization to follow on social because we're constantly posting EMS news, attaboys to different services that have clinical successes, as well as a lot of news pertaining to legislation that is coming up before our state legislature, and as well as our efforts to advocate on behalf of the Connecticut paramedics and EMTs. So if you're not already a member, you should head over to our website and check out the benefits and consider becoming a member today. All right, so the very first step to recertifying for National Registry is to get logged in. If you are in your first renewal cycle, I'll here highlight a common pitfall that we've run into. There's some of us who actually ended up accidentally with 2 logins for National Registry. I had a login when I became an EMT, and when I went through a paramedic program, the instructor set me up for a new login. So if you go to log into your National Registry and you're confused on your login and you accidentally log into your EMT one, you'll have this moment of panic where it says nothing about paramedic there. And meanwhile, you really know that you are a paramedic. You might want to look at your login credentials. It's very possible you ended up with a second account. You can call the National Registry and they can merge the accounts for you and get it all straightened out. On that note, if you're having a hard time logging in, I know I've been able to connect many of my employees directly with National Registry. Every time I have called them, it has been a good experience. So that's, at the end of the day, that's one of the best resources, is just to give them a call. They've always been really helpful. They also have a lot of good help files available on their website, and they have a YouTube channel that has a lot of great walkthroughs and tutorials. Pretty similar to what we're going to be doing today. Yeah, so that's the first step. You got to get logged in. I'm going to go ahead and share my screen now. I thank my friend Tom Latosik for allowing us his login to be able to show you some of these features. Okay, so here we are. Oh, let me make sure to continue. So when you first log in, you will usually go to the candidate setting. That is pertinent when you're actually getting your initial certification. But once you are certified, you will need to click the drop down to go to My Certification. All right, and the very first page it goes to is your dashboard. As we were talking about a little bit before the presentation started, this website was revamped a couple years ago, and I have to say I have really positive things to say about the revamp. They really made it a lot easier to use. So on this dashboard view, gives you some of your basic demographic information. Every time you log in, it's really a good time to go ahead and verify that if you need to. Update your profile, make sure you have your proper particulars on file with them. You'll also notice that the Recert cycle here is identified. So it looks like Tom is not due to recertify until 3/31 of 22. So it's important to note that while he's able to log all of his education, he won't be able to start his recertification application until October 1st of 2021. So this October would be the earliest he could submit his recertification. But educational hours you can put in at any time. So as we scroll down, we'll see we have this handy graph here that tells us exactly how many hours we've completed or have remaining. So Tom, may have already completed CEs. I suspect, knowing him, that he's probably well over these hours yet. He just hasn't inputted any into here. It's also important to note that he is affiliated with 2 agencies and 1 state. So the NR-EMT does allow you to affiliate with multiple agencies. I'll cover some of the reasons why you might want to do that. If we click on this and say I needed to affiliate with another one, I would click here. You need to be affiliated with at least 1 agency because you'll need an agency and a medical director to verify you're actively working in EMS and to do the skills verification. So if you don't affiliate, you won't be able to complete that step of the recertification process. And at that point, if you're not affiliated because you're not working, for example, then you would switch to inactive status. And that's a whole separate process there. We can make a separate video on how to go inactive or get out of being inactive. Some of the benefits to affiliating with an agency besides having your work and skills verified is that if you, so for example, I manage the training officer role for Vintech for National Registry. I'm then able to, when I run a course at Vintech, to directly assign course credit to my employees, so that when they go to log their hours, they don't have to type in all the particulars of a class. I can specifically upload a whole course with a roster, and I can save a lot of paperwork for my employees. So that's a good reason to be affiliated with an agency. If you're taking a lot of courses with them and they do upload those rosters, that's a really cool perk. So I have someone else joining us here. Okay. All right, so that's agency affiliations and why you would want to affiliate with anyone. The other thing is you need to have a state affiliation, which he's already done with Connecticut. If this is the first time you're recertifying, you would need to fill that out. Verification: if you're affiliated with an agency, your training officer or medical director will be automatically prompted to complete your skills verification. Now, a little note here about that automatically prompted part. As far as I know, I have never received an email notification from National Registry when I had someone to verify. I do try to log in here as much as possible and just check, but without actually going to the tab on the training officer side and clicking on pending verifications or agency affiliation requests, I don't get any notifications of that. So that's an important thing to know. If your application is being held up at your agency, it might be a good time to send a friendly reminder, email or phone call to whoever is the training officer there, just to let them know that you have a pending application. We don't get like pop-ups or emails saying someone's waiting on you, so I always appreciate being contacted. This quick view shows some recently completed courses, all right, so the next step, that was the dashboard. We can go into the transcript. Now, there's an important toggle on here for current Recert cycle only. It will save all your courses in perpetuity. That's important if you ever get audited, which we'll talk about in a second, or just for your own reference. But right now it's showing only courses that were completed during this Recert cycle. So remember that you have 2 years to complete all those CMEs. They can be completed in the first month after you complete your previous renewal, or in the last month. So any time within there. So right now he has one that he has completed and it has yet to be assigned, and we'll look in a second on how to assign those. Another important note here is we see these 2 buttons at the top. There's this button for add a new course by transcript. It does the same thing as clicking one over here. And what that'll bring us to is a series of fields that prompts us to enter a course from scratch. Now this could be a course that we took at a local hospital that was approved by the state OMS office, or it could be, for example, a course that we took at a national conference that was CAPC approved. Now, when someone teaches a CAPC approved course, they do have the ability to directly input it on here. You can see Tom has taken a couple through Flightbridge ED that he's able to directly import over here. So when you're considering taking CMEs from through a learning management system or through a third party, and a great thing to consider or to ask them about is whether or not they directly export to National Registry. That can save us a lot of time if someone does that. The other thing is along the lines of learning management systems, the only one that I'm directly familiar with is the one I use is EMS One Academy, and that supports that feature. So if you're looking into buying a third-party learning management system that you're going to use to take CMEs, look into that as well, whether or not they offer this direct import. You'll see in a second it's a little bit cumbersome and time-consuming to add a course from scratch. We're gonna do one to demonstrate it, but it would save you a lot of time. Okay, so let's go ahead and let's do that. Let's add a course. I have a record here. Tom took hazmat through us, so I'm gonna put that in for him. So the first thing that pops up here I'll talk about is standardized courses before I go and input Tom's CME. Standardized course are courses like BLS, PALS, ACLS, PHLS. There's a really long list. You can click this link here. And those may be used for the local or individual requirement. So, again, that also saves you time. If you take a PHLS class, rather than having to input all those individual hours, you can click on it and it'll suggest where you should apply it to. You can also take a refresher course. Again, if you're taking one through an agency, they should be able to populate that all on here, and if it's going to follow a standard format, that saves you from entering things all individually. I know they do give credit for college courses. I'm not terribly familiar with that process, but if you are involved in a college course that pertains to EMS, you might be able to get some credit for that. And then there's this initial EMS education program. This would apply to people that are currently EMTs and enrolled in a paramedic program. The National Registry will count that paramedic program towards your refresher. So if your EMT expires in the middle of a paramedic program, chances are with what you've completed so far in your paramedic course, you'll be able to count that towards that. But let's go back to the main reason why you'll be adding a new course. For most people, they'll be using it to add a CME course. The course name here is Hazmat for First Responders. He took this through EMS One Academy, so it was CAPC approved. He completed it on 12/1/20. Okay, it was 2 hours long. Now, did he teach the course? No. This next question, was an instructor present at this course? Now, prior to COVID, there was a requirement that a certain percentage of courses have a live instructor, and that could be either a live instructor in the classroom with you or one that's live virtually, called video instructor-led training, and like what the presentation that we're having today. As long as an instructor is live and able to answer your questions, then that would count towards the live component. In this case, an instructor was not present. This was a offline distributed course. Just to give you an example of what those requirements were, Connecticut's someone's microphone just came on. Connecticut's document that they put out for recertification requirements is actually very easy to follow. Shows you that for the core competencies, you can have up to 10 hours online. That has been changed because of COVID, and now you can do 100% online. Hey, Scott, thanks for joining us. Can you mute your microphone?
Can I ask you a question, Nick?
Yeah, go for it.
Do we know yet what the National Registry requirements can be for the 2022 Recert cycle?
That is a good question. I don't know if that has been released off the top of my head.
Okay.
Yeah, sorry. I can look that up and get back to you on that one. I'm well versed on what the current requirements are.
Oh yeah, yes, me too. So I Recert in March 21 or March 22. And so I've done a lot of distance CMEs, obviously with COVID. So I'm just wondering if I'm going to have to now go back and do a lot of live CMEs in the next 8 months or next year.
Yeah, I haven't heard one way or the other yet, but there's definitely something that we'll keep our eyes on.
Perfect. Thanks, Nick.
Yep. So again, this, as Scott and I were just talking about, Connecticut as well as National Registry has permitted for this research cycle because of COVID for 100% of your training to be online without a live instructor. Right here is where you'd upload the attachments. I have Tom's certificate here. I haven't scanned it in yet, but this is where you would add it. Now, a little note about uploading these attachments and the certificates. To my understanding, there's no requirement that you include these, but if you don't, you're again, this is from the National Registry's own help documents, you're increasing the likelihood that you'll be audited. So what's an audit? Well, both State of Connecticut for the EMT Recert and National Registry for all levels, they have the right to audit your training, where they can request a certificate of completion, and that's why you would want to attach it here. So in the case you do get audited, if you have all of your documents already uploaded here, they're all in one place, they're available, you're not going to lose them 2 or 3 years later. So I recommend uploading a certificate with every course that you attend in case you ever need it. Course location, so this is obviously if you took a live class, it's where you took it. In the case of distributed learning, you can put in the town you were in when you completed the training. If you wanted to, you can put in a lead instructor name. This was distributed training, so we don't need to put that in there. So here we could keep adding more courses. We're going to save it and view our transcript. All right, so now we have 2 courses on there, and you'll note that both of them are unassigned. So the next step is going to be to go to Manage My Education. And now we get into this, this need to distribute our training across these NCCR categories. So I always recommend trying to apply, where applicable, your credits to the national component first, because right now Connecticut does not have a state component. I'm off the top of my head, I'm not aware of any medical controls that require a local component, but I could be wrong about that. If they did, it would be available here. Say for example, the hospital that you have medical control through requires National Registry. They have the ability as a local authority to include a local component, and they can put very specific things here. Like let's say you do RSI at your hospital, they could require you to go through their RSI spot or their RSI class. So again, let's try to fill out these national components first. I know Hazmat will work for the operations, so I can click on it here. It defaults to allowing you to use the full 2 hours of the courses, but let's say I was in a situation where I only needed 1 more hour of operations. I could apply 1 hour here, and I can use the remaining hour down in my individual component. So that might be why I would want to split something up. And then within these specific areas, there's some subtopics that are required. One of the benefits to taking the national component, at least as a refresher course, is that you know that the instructor is going to structure it in a way where it meets all these individual national components and subtopics. So I think it's reasonable to practical thing to do is to take the national component through an organization and then use the additional 30 hours of local or individual to do exactly that. Find courses that are really pertinent to the location that you're working and the types of patients you see commonly, or the skills or medications that are required at the site you're working. All right, the next thing we need to talk about is verification. As we mentioned on your dashboard, you have a spot here for verification. So once you submit your Recert application, we'll be prompted to verify. Now, in the case of Vintech, we don't have our own medical director. We have to reach out to the medical director where our employees are working to have them verify it. So as an employer, we facilitate that process, but just know that wherever you're working, if you need to renew your national registry, you'll most likely need to contact your medical director that you have medical control through. And they should be pretty well versed in this process. I don't know that No one really knows the exact percentage of Connecticut paramedics that are nationally registered, but I assume there's enough of them that the hospitals deal with this on a fairly frequent basis. Now, what are the requirements for verification? Well, first of all, you need to be working at your skill level. If you are not working for 2 or 3 years for whatever reason, that's where you would go to inactive status. And in that case, a medical director would not be able to sign off that you're actively working. The other component there is skills verification. So there's a couple different ways that skills verifications can be done. Again, this is the state of Connecticut website, but it really summarizes it well, so I like to use this as a good reference document, and it totally corresponds with National Registry. But at the paramedic level, you need documentation from a physician medical director. EMTs can be verified by an EMSI, and that the director will certify that you have done the following skills. There's different ways for them to accomplish this. One is that they can look at existing call records. So based on a review of your charts, they can have you come into a lab and do your skills on mannequins or do an actual skills exam. So the lab demonstration might be a little more informal, like skills day. I know that's how at one of our sites we accomplish the skills validation every year. We send a approval to our medical director at that site to run a skills day and identify what we're going to be doing, and based upon your successful completion of that, the medical director will sign off your skills. In Connecticut, they are using a T6 form, and these are the skills you need to demonstrate. And I've also seen locations do some combination of this. If you're they'll look at a chart review and say, okay, well, if you haven't intubated anyone in the last year, you'll have to come in and do that skill, and then the other ones will verify based upon your charts. So it does help to get in touch with your medical director way prior to this happening. You can only imagine the requirements that are being placed on the staff at those hospitals right now. Everybody is short-staffed and running long lead times, so this validation part is definitely something you do not want to wait for till the end. You want to get this part done pretty early and have a plan for who is going to verify your skills, especially if you're working at multiple agencies. Again, Connecticut does not have a state requirement. First of all, even in jumping back even farther, Connecticut does not require paramedics to maintain their National Registry Recert at this point. It says right here, this is a state OMS document. They're providing this as a courtesy. So that's the current status of things. We know in the state of Connecticut anything can change. So, all right, back to the National Registry website. At any point, we can view our full transcript and be able to see how many courses we have unassigned. I do need to jump back though. When I'm in managing my education, it's important to note that the only courses that will pop up here are ones that have not yet been assigned. So if we haven't assigned a course, they'll show up here. That's a common question I get. Someone tell me, I've taken a course, how come it's not showing up here? Chances are they've already assigned it to a different category. And sometimes you have to unassign and reassign to make all of the requirements work. And we can always go back to our dashboard to really get an idea of exactly where we stand. And this can inform us, what areas we might need to pick up a couple hours, extra hours in. Any other questions at this point? I see none of them in the chat.
Nick, is there a standard, like when we do CPR or ACLS, is there a standard amount of hours we can take for each of those courses?
Absolutely. I think you may have jumped in after that, but I will go back to that. So when you go to add a course, it actually defaults to standardized courses. So like let's pick ACLS, for example. If you click on this Learn About Standardized, there's another graphic that you can find where it shows exactly where you can apply an ACLS course to meet the state and local requirements. So it shows you, what part of it is cardiac, what part of it is airway, But yeah, that's the nice thing about taking one of those pre-prepared courses is that is already filled in for you.
Okay, because like the hours didn't populate, so it'll tell you on that separate document.
Yeah, I thought it was when you click this, but there's, oh, is it standardized course guide? There it is. All right, so if you take, I think this is the course I'm looking for. Oh yeah, so like CPR can be applied to ventilation, oxygenation, and under cardiology it can be see how it breaks down?
Yeah.
PEP.
Does it say like how many hours though for each one?
Well, it's the total number of hours. So if you needed to, you could apply all of your CPR hours to ventilation.
Gotcha. Okay.
And interestingly enough, they'll let you apply some to operations. Oh, I'm sorry. Total. Oh, maybe there is a cap. You know what? I haven't put one of these courses in a while, so that's a good question, Scott. Maybe the hours are listed here. Those are the total hour requirements. That's what that is.
Right,
so for paramedic, you need 3.5 hours of airway, respiratory ventilation. Yeah, it doesn't. I haven't seen anywhere that there's a cap, but I haven't actually tried to put one of those in a while. So that would be an interesting thing to try.
Okay. Yeah, I just wasn't sure if there was like CPR counts for X. So it says like right there, CPR counts for 3 hours.
Yeah.
Up at the top, but like does the ACLS count for 4 hours, or does like is there a standard?
Yeah, I think when you click on the standardized course, it pops up with the hours. When you actually input it, because it doesn't ask you to input the hours down here. The other ones, it asks you to input the hour. Oh, no, it does. Okay.
Yeah, that's what I was just confused about.
Yeah. I'm gonna definitely say I do not know the answer to that, but I will look it up, and when I post this video, I will add that into the course description, the answer to it.
Okay.
For completeness. There's a very lengthy PDF guide for this that has some of those more nuanced questions. And then the other asterisk I add anytime I talk about National Registry is don't be afraid to give them a call. I've never had a bad experience calling them. Everybody on the phone has been pretty savvy and knows what they're talking about, is able to very quickly give me an answer. Because chances are the questions you're asking them, they get 10 times a day. So
sure.
It's a great resource. Don't be afraid to call them.
Okay, cool. Thanks, Nick.
Yep. Any other questions? All right, well, that should wrap everything up for today. Again, as I mentioned, please check out CAPE on the web at cape911.org and consider joining. And there's many more webinars that we offer like this to our members directly, and that we have big plans to be offering. So we have a lot to look forward to, and thank you for joining us today.
Awesome. Thank you, Nick, so much. I appreciate that.
Thank you very much, Nick.
Thanks, guys.
All right. Take care.